lectures on community diagnosis by Eze Ararunyeka. Community diagnosis is a very important tool that is used in community health practice. The tool is very important for you to carry every member of the community along, okay? Because it prioritizes on the real needs of the people, okay? So, community diagnosis is the process of determining the actual health problem of a community, the exact nature, and the relative size of the problem the people are having. Community diagnosis, involves a systematic process. That is, from one particular step, you move to the other. You don't jump steps because it is a systematic process. It is applied in public health and also in community health practice to identify and understand the health need of the people and other issues within that particular community. It could be a health need. It could be an infrastructural issue. It involves gathering and analyzing data to determine the actual health problems, the nature, and the extent of these problems within the community. What type of problem do these people have? How big is it? Is it too common? Is it a situation that has not occurred before? Is it a life-threatening one? So this is what the diagnosis tries to look at. What is the exact problem of these people? How does it affect them? Does this problem affect them to the extent that it is becoming life-threatening? Does it affect their social health? Does it affect their mental health? Has it eaten deep to the point that they are now repelling every orthodox practice? This is what community diagnosis tries to identify. The main goal of community diagnosis is to provide a comprehensive understanding of the health status of a community. So collectively, diagnosis will reveal, like we do in clinic. You try to hear the complaint of the patient. What about the patient, the chief complaint, the presenting illness, the family history, social history, drug history, then past medical histories. From all these informations you've gathered, you will come to say, this is likely the problem of this person. And that is diagnosis, clinical diagnosis. In the community, we diagnose the community at population level. That this is the problem of these people. So you are going to collect a whole lot of information from the community so that you can arrive that this is the actual problem of this community. So this tool called community diagnosis will now help you, the healthcare worker, the CHU, the CHO, the JCHU, to understand the actual health status of these people. And then you can conclude and say that they have poor health status or the reverse. Okay? And you now understand the extent it's affecting them. It could be that it's affecting to the point they don't have access to healthcare, or it's now becoming life-threatening. That is what community diagnosis tries to dissect and to give you a comprehensive understanding of the health status of these people, which can be poor or the reverse. The main goal of community diagnosis, as I said earlier, is to provide a comprehensive understanding of the health status of the community, which can then be used to develop effective health interventions. So from the information you've gathered, and you'll be able to analyze, say, this is the problem of these people. You can now begin to come up with interventions to abet, to promote, to restore this community. So in a nutshell, the process of community diagnosis involves the following. One, data collection. There must be data collection. You have to collect data from the community, including demographics, the male to female ratio. How many number of male do we have and the females? What is the age distribution? Is it a growing population or an aging population where there is more older people than the younger people? Who are mostly affected by a particular disease condition? The male, the female, the children, the mothers who are pregnant, or the elderly persons. You are going to collect data on that. The health indicators. You're going to look at the health indicators. The immunization status. How many children received 5 complete doses of OPV? According to national guidelines, or 4 doses of OPV. How many children received the complete doses of pentavalent vaccine? We're also going to look at the other indicators, immunization coverage. Also going to look at social determinants of health. You're going to look at it. These are where you're going to collect information. We'll look at social determinants of health. You're also going to look at environmental factors such as pollution. You're also going to look at geographical factors that are likely to affect. Is it montane vegetation? Is it a mountain area? Is it a hilly area? Is it erosion-prone area? You are going to collect that on that. You are also going to review existing health services. What services are existing in that community that is used to respond to healthcare issues? You are going to collect data on that. You're going to look at, do they have schools? And all of that. You're going to collect that. You're also going to review their past medical health record. And you're going to also collect real-time data like nutrition status. You're going to perform some work on children under 5. So it's a systematic process that you have to take what easy from one step to the other. Otherwise, you will make a mistake. You're also going to embark on data analysis. By the time you have collected all this data, you are going to use what is called matrix ranking to rank and say, this is the actual health problem of these people, and this is the one we can solve. That is matrix ranking. You are going to also involve in community engagement. I'm just giving you an overview. You're going to involve in community engagement. You're going to involve the members of the community, the stakeholders, any local organization resident in that community. You're going to involve them. At the end of it all, you are going to involve in problem identification, need assessment, and then you develop interventions that will be used. We call it targeted interventions that will be used to solve or address the identified health problems. And at the end of it all, you are going to involve in monitoring and evaluation of the effectiveness of the targeted intervention. What are the rationale for community diagnosis? One, it provides specific information. Community diagnosis offers detailed and specific information about the health status, needs, challenges faced by a particular community. This information is essential for understanding the unique characteristics and dynamics of that community, because we are going in details to carry out information, to dig out information, to assess, to gather data. You are going to have a lot of information that is only peculiar to that community. So it provides what information? It provides foundation for planning by providing comprehensive data on health issues. Forms of community diagnosis, it now forms the foundation for developing effective plans and strategies to address the problem and meet the identified needs of the community. It will help you to prioritize and allocate your resources appropriately. Because you have lots of information about the community, it will help you to prioritize. Now, this is the problem that is most pressing that we should solve. And look at who will do it. Look at where we're going to do it. So it gives the foundation for planning. It identifies the nature and size of the problem. By the time you have carried out an extensive survey to identify a lot of factors, you will have understood the exact nature that maybe this problem is life-threatening. You have understood the magnitude of health problem. How many persons are involved? Who are involved? Are they female? Are they mothers? Is it maternal mortality? This information is essential for designing targeted interventions and programs to address the specific health issues prevalent in the community. It aids in managerial decision-making. The data and insight obtained through community diagnosis provide a basis for managerial decision-making in health development initiatives. It helps health authorities and policymakers in making informed decisions about resource allocation, program implementation, and monitoring the progress. You have every data. You now make an informed decisions so that the resources available will be used optimally to solve the problems that you can solve, and not venturing into a problem that you cannot finish because of scarcity of resources. So it aids managerial decision making. It tailors health programs to community need. Because you have done extensive assessments and you have prioritized, every solution or targeted intervention you are bringing is meant to solve the community needs, because you have understood their health priorities and the challenges they face. The next is it promotes immediate intervention. Community diagnosis facilitates the identification of real and pressing health needs within a community, which leads to immediate intervention. This proactive approach ensures that resources are directed towards addressing the most critical health issues promptly, thereby improving the health outcome of the population. What are the aims and objectives? What are the aims and objectives of community diagnosis? Remember, community diagnosis is a systematic process or approach, like in clinical diagnosis. So it is in a stepwise fashion, and you deal with lots of data. One of the aims is to determine what information is needed to assess the community health problem. This objective focuses on identifying the specific data and information required to understand the health issues prevalent in the community. It involves gathering data on demographics, health behaviors, environmental factors, healthcare assets, existing health services. By determining the necessary information, community health practitioners can effectively analyze and address the health problems faced by the community. It is your responsibility as a community health practitioner to analyze and address the problem faced by the community. So that is why it's a systematic approach. So one of the aims is to determine what information is needed to assess the health problems, because you cannot actually identify what is the problem of these people unless you have gathered data. And for the data you've gathered, you now make analysis and come up, this is the problem, and prioritize based on resources. So one of the aims while you are deploying community diagnosis as a tool is, one, for you to determine what or to get the information you require for you to analyze and say, yes, this is the problem of the community. So that's one of the aims of using community diagnosis, to determine what information is needed for you to find out the information that you would need to solve their problem. That's why you are deploying it. Secondly, is to enable appropriate and timely decision on intervention mostly needed by the community. Yes, let's say you are posted to a particular community newly, and by the time you don't know where to start. Once you deploy the community diagnosis tool, it will enable you to appropriately and timely decide on intervention most needed by the community, because you now have the data. You are not saying that this is their problem. So therefore, for us to solve this problem within the shortest period, we are going to use campaign. We're going to use mass media. We're going to deploy house-to-house mechanisms. So it enables you to identify appropriate and timely decisions on the intervention mostly needed by the community. So by the time you have taken that, it will help you to determine which of these interventions will have the greatest impact on improving the community health. And the timely decision will ensure that interventions are implemented promptly to address the health problem effectively. So that is why you use what? Community diagnosis. Next is, another aim is to determine health needs and priority of the community. We have explained this. This objective involves identifying specific health needs and priorities of the community, because it enables you to understand the unique health challenge the community is facing. So therefore, will help you develop targeted interventions that will address these needs effectively. Another aim is to provide guidelines for strategy for intervention. Community diagnosis helps in identifying the specific health issues prevalent in a community. This information is essential for developing targeted strategies and interventions to address these health concerns effectively. Another aim why you use it is for you to determine the resources needed. By the time you have gathered data on environmental factors, geographical factors, resources, infrastructure, you will have understood the resources the people have, which you will now use effectively, timely, and efficiently to address the health need of the people. These resources can also be medical supplies, personnel, infrastructures that are present in the community. So it helps you. So the aims why you use community diagnosis is to determine what information that you need for you to come up that this is their problem, for you to determine the information needed. Then to enable you engage in appropriate and timely decision on intervention most likely needed by the community. Then to determine the health needs and priorities of the community. Then to enable you gather the guidelines for strategy for what intervention. Then to help you determine the resources what needed. Another aim is to enable you measure the intervention effectiveness. Community diagnosis serves as a baseline assessment that allows for the evaluation of the effectiveness of intervention programs over time by comparing data before and after intervention. Healthcare providers can determine the impact of their effort on the health outcome of the community. Another aim is showing disease occurrence and risk factors. Community diagnosis helps in identifying the prevalence of diseases within a community and the associated risk factors. That is why you use it too. So the aim is for you to understand the disease occurrence and risk factors. Another aim is for baseline surveillance. Community diagnosis serves as a foundation establishing surveillance system to monitor malnutrition, disease outbreak, and other health indicators. Another is, it is an indicator of community health level. Yes, this tool will help you to know which level of health is existing in this community. So community diagnosis data can be used as an indicator to assess the overall health status of a community during health surveys. So these are the aims of community diagnosis. So these are the aims of community diagnosis and also the roles of community diagnosis. I'll take it again. One, the aim is to determine what information is needed to assess the community health problem. Two, another aim is to enable appropriate and timely decisions on intervention mostly needed by the community. Three, another aim is to determine health needs and priorities of the community. So the above three is the major aims of what? Community diagnosis. Whereas the roles, which are also somehow linked with the aim, includes so the three are the main aims, whereas the roles or the functions include, it provides guidelines for strategy for intervention. So community diagnosis helps in identifying the specific health needs prevalent in the community. That's one of the functions of the role. It helps to determine the resources needed because you have already carried out the data. So this particular function also can serve as an aim. By the time you say to determine resources needed, it becomes an aim. But when you remove to and say it determines resources needed, it becomes the function that it actually functions in helping you to determine the resources needed. Okay. It also helps in measuring intervention effectiveness because you already have the data at hand. It will help you to measure if that intervention you are putting to solve that problem is actually working. Then it shows disease occurrence and risk factors in the community. It shows it because you have collected data already. You have collected the data already. You now have the information handy. Then it provides the basis for surveillance because you already know the fact the data to be continually monitored. You can now mount strict surveillance to ensure there is outbreak is identified as early as possible. It also provides the indicator for community health level. So these are the functions of diagnosis and can also be the aims once you add to. Okay? To indicate community health level, it becomes an objective while you are deploying the community diagnosis tool. What are the methods employed in diagnosis? The method employed in diagnosing the community involves various approaches to gather information and assess the overall health and well-being of the community. One is observation. Observation involves visually examining various aspects of the community, such as human behavior, environmental conditions, basic infrastructures like housing, sanitation facilities, and the ability of health services. So you're going to walk around the village members to look at around the environment to see how they are carrying environmental sanitation. You're also going to examine children on the farm. You're going to look at the housing, the sanitation, and other human behavior, especially healthcare seeking behaviors and lifestyles. Then you're also going to deploy another method employed in diagnosing community is interview. Like in medicine, in clinical care, you are going to deploy radiological investigation, laboratory investigation, physical examination, history taking. Okay, so that's the same way you are going to deploy here, but here you are deploying various methods such as observation, interviews, and surveys. You are going to conduct interviews and surveys, like if in questionnaire form, to gather information directly from the community members. This can be through structured interviews or surveys. You can then collect data on healthcare practices, hand hygiene, oral toileting, the type of food they cook, how they prepare the food, then access to healthcare services, their attitude and knowledge, prevalent diseases in that community, and other relevant information. You are going to collect information from the community using the interview and survey. Then you're going to deploy focus group discussion. You can just engage maybe the youth leader, the women leader, and the PG, the President General, and ask some information. This group discussion involves bringing together a group of committee members to discuss health-related issues, share their experience, provide feedback, okay? And focus group discussions are more targeted discussions with specific groups within the community, such as women, children, and elderly people. You are also going to review existing records in the community, such as treatment cards, health registers, and other health-related documents, which can provide valuable information on the health status of the community. Okay? Then you are also going to carry out physical examination of humans. Physical examination involves assessing the health status of the individuals through clinical examination. Okay? So this will also help identify the type of diseases they are suffering in that community. Now, let's look at the steps for community diagnosis. First, you have to make entry through the local government into the community. That's the first step. You have to identify, go to the local government, get the required approval before you go to the community. Then you also have to identify the boundaries of the community. Then you are going to make a sketch map of the community, or you obtain one from GIS. Then you make a list of resources available in the community. That's when you have actually gone to community, you are going to gather, or what are the resources this community have, such as industries, markets, churches, mosques, health facilities, labor organization, NGOs. Then you make a list of cultural practices and attitudes affecting health in the community. Because you have carried an assessment, you should be able to identify the cultural practices. Do they practice FGM, cow dung, and all of that? You are going to identify them and list them. Then you're going to describe social customs and important festivals of the community. You're going to describe those ones you have identified in the community. You're also going to make a list of infrastructure in the community, such as, do they have electricity, pipe-borne water, means of transportation? You are going to also make a list for it. Then you are going to collect information from the community. That is through surveys and questionnaire. Then you conduct interview surveys of social groups in the community, so that the youth, the age grade, and all of that. Then you write a report using Federal Ministry of Health format. Then give feedback to the local government, state, and Federal Ministry of Health. What type of data are you likely to obtain from the community during community diagnosis? One, epidemiological data. The epidemiology, which we know is the study of disease occurrence, it determines the population, and the use of the knowledge in controlling disease. So it will give you the knowledge or information such as what type of diseases are available in that community. Who and who is more affected? Is it the children, the elderly, the young? You are going to know from the information obtained. Then it also tells the incubation period of the disease. What are the clinical signs and symptoms that this disease presents? Well, then you're also going to tell you morbidity and mortality pattern in that community. The next information is going to give you demographic data, which includes size of the population, birth rates, dependency ratio, life expectancy, death rate, migration, causes of death, sex distribution, and age distribution. It's going to provide these information to you. Then it's going to provide factors such as information such as factors affecting health, cultural factors such as culture, belief, taboos in the community. So it's going to provide personal information. Their educational level, it's going to provide you those informations, educational level, attitude towards healthcare, personal hygiene level, and all of that. Environmental factors, their refuse disposal system, waste disposal system, liquid waste disposal system, okay, and other activities in the environment is going to give you this information. Then health problems in the community is going to give you this information. The leading cause of death and diseases, nutritional status in the community, health facilities, where it's located, the distance to the facility, and the location. Then the total number of hospitals in that area, and the distance. Then it's going to look at environmental characteristics, types of land that are found in that place, whether it's fertile or arid. So it's going to provide information on the sources of water these people are using, the means of waste disposal, the climatic conditions, such as the amount of rainfall they have there and the temperature. Also, the housing condition. It could be an urban arrangement or a slum. It's also going to provide you with socioeconomic factors that are found there, such as social amenities, occupation of the people, religion, religious group, social organization, and road network. So these are the information that the community diagnosis is likely to provide you with. So I believe we've been able to discuss this all-important tool known as community diagnosis. Thank you and have a blessed day.